Hello YouTube. Have you noticed what I've started doing? Drinking a lot of milk. And I drink a lot of it. I'm drinking lots and lots of milk. You want to know why? Because I'm really trying to stay healthy. And I'm trying to stay as healthy as I can, and I hope that all of you are too. Because here in a matter of probably a couple of months, 3 months, possibly a year, Obama's new health reform care plan, as I like to call it, others call it the health care reform plan, will be enacted. Could be enacted. If it is enacted, we are all going to have to hope and pray that we are very healthy and that we are productive citizens in society, because this is how this whole plan works. Okay, Obama's health care reform plan states that what this basically is a form of governmental insurance provided to people who are uninsured. People will be required to insure their children, but the adults themselves do not have to take the insurance if they do not want it. If you are already covered under your company that you work for, or you already have private insurance, you don't have to take it. No one's forcing anybody to take anything. Seems fair enough, doesn't it? But if you dig a little bit deeper, you might find that these are some likely scenarios. Okay, the government suddenly offers free health care. What do you think the companies that are providing health care to their workers are going to think about this? I mean, we're dishing out a lot of money here to bring our employees in to give them insurance. And if the government's going to do it for free, then why do we need to do it anymore? So, these big companies drop the insurance coverage that they have on their workers. Their workers are now uninsured. Those workers now have to take Obama's insurance, which is a universal government insurance. Now, it doesn't sound that bad. The first time I heard about this, I thought, hey, if you had this kind of insurance, it couldn't be that bad. You know, it's better than nothing, isn't it? Well, if the insurance was just hanging out there, you know, okay, could I be uninsured or buy my own insurance or get the government insurance? I'll take 1, 2, or 3. I'll take 3. It's not like that, though. The thing that's going to happen is that if this governmental insurance is brought about, other insurance companies are going to give up their coverage. Companies that have medical coverage are no longer going to provide it to their employees. The employees will now have no choice but to purchase private insurance, which they are never going to be able to afford, or they can go and get Obama's free insurance. Now, freeness isn't free, in case no one had ever told you that. Now, you have this free insurance. This free insurance basically tells you what doctor you're going to have. If your doctor turns out to be a cocaine-addicted alcoholic who hasn't been to med school in over 25 years, tough luck. Okay, you've got an infected tooth. Is that tooth life-threatening? Can you hold it in your mouth? Will it eventually just fall out if untreated? Okay, it will. Oh, it causes you extremely large amounts of pain? Take some Tylenol for it. As long as it's not life-threatening, don't get it done. There's going to be all kinds of things on this new governmental insurance that's going to make people's eyes go up into their skulls. It's going to make their jaws drop to the ground. And here's an interesting little chart that a friend of mine drew me the other day. I don't know if you can make any of that out, but here's how it goes. This is where it starts. Children starting at age 1. Okay, basically this line indicates the level of coverage that they're going to get. In other words, if they get sick or they get hurt, how well they're going to get taken care of. Now, young children at ages 1 to 4 to 8 to 9, it starts going up, but they don't have the best coverage. Okay, it starts going up age 16, age 17, age 19, age 20, age 21, age 22, age 21, age 22, age 23, 24, 28. Alright, right in this area, right up here at the top. These are the people between the ages of 24 to 35. Now, what are people between the ages of 24 and 35? They are going to be considered the country's most productive citizens. In other words, the people who are able and capable of working the most get the most coverage. Now, as people get older, they get less and less productive, as so the government says. So, since right around here, when people begin to hit 40, their coverage rapidly begins to drop because their productivity is losing. It's going down, it's going down, it's going down, it's going down. Now we've hit 60. Now we're going down to 60, 62, 64, 65. We've hit the level of people that are going to be collecting. They're going to be collecting Social Security. They no longer work. They are no longer productive citizens at all. So, if they get cancer, if they get hurt in a car wreck, what do you think that the government is going to do with them? When they're lying in a hospital bed with their leg half caught off, and the doctor examines the plan that they have, and it's called Obama K101. I can't imagine what the name of this governmental plan, healthcare, is going to be, but if it is that, he's going to say, well, this insurance doesn't pay for her to get that fixed, so we're just going to pump her full of drugs, let it rot off, sew it up, send her home. Or if one of your relatives is laying on a hospital bed with cancer and they are over the age of 65, they no longer work. Now they are no longer productive citizens of society. They may possibly be given some sort of suicide drugs to help ease their suffering, and they will get sent home. They will get sent home to die because they are no longer productive citizens of society. Now, I'm not sure entirely how true all this information that I've been given is, but from what I've seen, it is. In other words, this governmental healthcare plan is only interested in giving health insurance to the most productive citizens. Now, it doesn't sound that bad in terms of, well, I mean, what do you expect if the government's giving you free health care? What can you expect? Sounds alright. You don't have to take it. You can keep your old plan, but here's the kicker. These old plans they're not going to exist much longer. Companies are not going to keep their employers on their current plans because they're going to eliminate those plans because there is now a free plan. Companies are no longer going to carry insurance. It's just people are going to be forced to go get this governmental insurance. They're going to be stuck with it. So, something you might want to think about the next time you drive down the road with a sticker on the back of your car that says, "All Hail Obama." You know, this is the exact same idealism that's fueled the Nazis. The Nazis believed in survival of the fittest. They believed in preserving the most productive group of people and exterminating the rest. It was known as the euthanasia program. Anyone who was handicapped, anyone who was elderly, anyone who was physically handicapped, mentally, was considered useless. They were completely useless to society, and they had to be eradicated. And basically, this is the same concept. Give health care to those who can work. If he broke his leg, if we fixed it, could he get back up and go work again? Okay. Well, if this old woman fell down and broke her hip,